Good morning, everyone. It is 8 a.m., so we will go ahead and get started. Welcome to the Afib Quality Exchange call. My name is Audrey, and I will be your moderator today. Feel free to ask questions throughout the presentation by typing them in the chat box on the right hand of your screen, pressing the microphone at the bottom of your screen, or if you're using phone audio, press *6 to come off mute. The slides and links to the presentation will be sent out within 1 to 2 weeks from today's presentation. I will now turn over the presentation to Deb Moats, our Senior Director of Quality.
Thank you, Audrey. And if everybody would make sure that they're on mute to start out with, just so we don't get. But again, I'm Deb Moats for the American Heart Association. I'm here for the Get With the Guidelines Afib Exchange. What the exchange is this will be our first one for 2020, but typically we meet quarterly. And we just do a little short presentation. This is more meant for you than for us. So if there's questions you have, things that you're concerned about with the Afib module, anything like that, best practices you want to share, anything, just come off mute. If you're on the phone or if you're on the computer, I think you can just unmute it and let me know. And through questions, please feel free to just speak up and interrupt me. It's very informal. Oops. Okay, so our agenda today, the welcome we just did, and thank you everybody who got up this morning to join us in this presentation. I hope that it's formative for you. We're going to talk a little bit about day-to-days and the reports that you should have received here within the last month or so. We're going to talk a little bit about COVID-19. I'm going to talk about promoting your award-winning hospitals. If anybody had awards this year for Get With the Guidelines, I know that we're very, very late with these this year, but we should have our media kits by the end of the week, and you should receive your certificate along with your media kit here within the next week or so. And then we're going to talk about some educational opportunities that are available for you and some resources that may be available for you. So day-to-days in the Southwest region. This is something we started, a couple of years ago now, and really the purpose of it is just to let you know where we are or where you are in your hospital towards your achievement goals. The achievement measures are all scientific. They're scientific based on guidelines that have been published for AFib. So you should have received a report that looked kind of like this. The snapshot, it's just a snapshot of that day that we did it, but it kind of gives you an up-to-date view of where you need to be. For AFib, we only have achievement measures. There's no plus measures or anything like that. So the achievement measures are listed here below. So there's the ACE, ARB, and ARNI prescribed at discharge. If in your letter or your email that you received there's a red color in there, that means that that is not at your 85%, and you have to have all at 85% or higher in order to achieve the awards. The awards are per calendar year, so really the information doesn't all have to be in there until like next January. But if you keep going or keep it up, you can use this information for your performance improvement and those kind of things. The other measures are the beta blocker described prior to discharge if the LV ejection fraction is less than 40. And then your CHADS-VASc risk score prior to discharge, your approved anticoagulant prescribed prior to discharge, PT-INR planned follow-up prior to discharge if the patient's discharged on warfarin, and then a statin at discharge if the patient has a history of CAD, CVA, TIA, or peripheral vascular disease or diabetes. So if you did receive one of those, if you received the email and you have some red areas, then what you can do is go into your IRP, your PMT, I mean for the quintiles, which is your login screen here. So you just go ahead and log in like normal. Once you log in, this screen here below will come up the community page, and that page is just gives a lot of information about your hospital and also how many hospitals are participating in that particular module for Get With the Guidelines, and also how many hospitals you can benchmark against with your performance measures. So if you want to click down and figure out where am I and what fell out. So you would hit the reports, which is the bar chart, hit that, or click on that. Excuse me. When that opens, then click on Configurable Measure Reports, which is shown here. And that's also how you'll run your reports. But you select the time period of interest. And for this particular example, we said annually, January 2019 to 2019, because that was this last award period that you'll receive here next week. Then when you run your follow-up reports, you can drill down. So under when you're hitting, so the first measure that was red was the ACE Arbor Army prescribed and discharged. So select that measure, and then on your format where it says bar charts usually is the default, just click on that and hit patient records. And when you hit the patient records, then hit generate report. Once you generate the report, then you're going to review, or you'll see a patient grid like this. It includes all the patients in this measure. So all of your patients will be included. It'll let you know, is this patient supposed to be in the numerator, yes or no? If it says no, then that means those are the fallouts. If there's exceptions, there's a filter, and then what kind of rhythm. It's just got a few things. But yes means that it meets the measure. If you have no in the measure, then those are the patients that the results don't have a number in the numerator column. So that would mean it's a fallout. So then what you can do is at the very beginning, in this particular example, the first column is not there, but that's actually your patient ID. So you'll have your patient ID. You can click on that patient ID and it will take you right into the record, and then you can review the fallout to see if maybe you missed something that was documented, or maybe you forgot to check something or whatever. But you can do a review by patient that fell out in this manner. Any questions about that? You can either type in the chat box or *6 to unmute. Okay, so next thing we're going to talk about is preliminary data from COVID-19. So, well, I'm going to go to this one first. So this, what the American Heart did was back in April, they added some fields to the Get With the Guidelines stroke, AFib, and heart failure module to try to capture some of the COVID-19 information. So the modules, the first one for atrial fib is the element that was added was active bacterial or viral infection at admission or during hospitalization. And then you can choose which one, if it's COVID-19, if it's MERS, if it's something else. And then the logic behind that, it adds the ability to track those patients when they're entered in outcomes so that you can kind of run information and run reports on that specific disease state. And that was added on April 8th. And then we have our previous medical history, and there again added the history of emerging infectious disease. So there's another place that the COVID-19 could be marked. And that was for May, that has been implemented, and it has been updated in May. But really, you know, when you're looking at this information, your work is really driving the future of healthcare, because this is such a new thing. We really don't have a lot of information about it yet, as far as how it's affecting our stroke, heart, AFib patients, heart failure patients. We really don't know at this point, but we're starting to get some data in. There's also a separate COVID module that is free of charge. If you want to participate in that, then just let your AHA director know, and we can get that set up for you so that you can collect more COVID information. So I'll go back to this one. There's a COVID-19 content, the AHA's compendium. I can't say it right, but I'm sorry. But anyway, if you click on the site here, and you will receive a copy of these slides after this presentation is done, within the next couple weeks anyway. But when you click on this site, all of these new research articles that are coming up, and they're adding them all the time. You can see June 18th, there was one. June 23rd, there was one. When you look at the scientific or science news and AHA, there's podcasts on there you can listen to. There's just a lot of resources for you for your AHA or for the COVID-19 and related information to heart and stroke. But there's two in particular for AFib. One is the guidance for rebooting electrophysiology through the COVID-19 pandemic for the Heart Rhythm Society and the American Heart Association. It was published in the Circulation A&E on June 12th. And all you need to do is, if you go to that site, just click on the red, and that will take you directly to that article. The other article particular to AFib was guidance on acute management of AFib in COVID-19. And that again was published on June 9th. And so again, click on that and you can go in there and you can review that article to see if there's anything that you would like to add to your program or whatever to just for best practices. All right. We went through that one. So Flannery is my counterpart here at the American Heart Association that has the AFib expertise and helped me develop these slides. And she pulled this information together from the New York Times. This was just updated on July 6th, so it's very recent data. But you can see it's broken down here by the American Heart Association regions. Our region is in the red. That's the Southwest region for the American Heart Association. And as of the 6th, there were 288,000, almost 290,000 confirmed cases of COVID in our area, our 6-state area. You can see the other areas that have been hit pretty hard as well. Up in New York, over 1 million. There's just, a lot of COVID cases. So then we wanted to take a look, just a quick look. We have the most patients in stroke. So we just ran some preliminary data. When we send out these slides, these couple slides will not be included in it because this is really preliminary data, but we wanted to look at what was the national stroke volumes versus our Southwest region for the months of February through May when COVID first started until, past May, we really did not have enough data to really add anything for June. We don't really know how many people actually have entered all of their patients. We understand that a lot of the nurses are being pulled back. A lot of the coordinators are being pulled back to the bedside. And so we know that it's difficult to get this information in there. But as you can see from the early data, in February, the 2019, 2020, it was pretty much the same national. There wasn't a lot of differences, maybe a few more in 2020 than in 2019, as we usually expect. And then the Southwest region, same thing. There wasn't 47 difference in cases. But as you look across and you see in March, we're starting to see just a little bit of a drop of the ischemic stroke patients in 2020. And then looking for both the national and for the Southwest. So we're starting to see a little bit of drop. But if you get over here at the end from May, there's a drastic drop in the number of patients being admitted for ischemic stroke. We have a campaign called Don't Die of Doubt. There's a lot of materials available for you that you can use with your hospitals. What that campaign is talking about is for patients who are having stroke symptoms, heart attack symptoms, any kind of heart system symptoms, don't be afraid to go to the hospital because, we don't want you to don't die of doubt because don't be afraid. The hospital is the safest place. They have measures in effect so that they can help protect you. But what we're seeing is that a lot of patients just aren't calling 911 or just are not going to the hospital. We don't know exactly why, but most likely it's a fear. And as you can see in May, there's almost a 50% drop in both the national admissions for ischemic stroke as well as the Southwest affiliate. So that shows us a pretty good picture of what's going on across the nation in these early stages. And then we wanted to just take a look by state to see what is it looking like by state from February through May. So the darker green is the CVA and the lighter green is the CVA and COVID population. So you can see that it's starting to have more of effect as we travel. This is actually the whole aggregate, but Texas is, they're jumping up there to 0.22%, but Colorado, about 0.53% of their patients are COVID and CVA. So just some more interesting information, and it's going to be interesting to see how this continues as this COVID continues to surge. Do you have any questions about that information? Questions, comments? Okay. So briefly, if you're getting an award, the Get With the Guidelines Awards is what I'm talking about. And it's the bronze, the silver, and the gold are the award levels. So bronze is 3 months of 85% or higher in all of those measures for performance measures. For silver, it's 12 months at 85% or higher consecutively. And then for the gold, it is 24 months consecutive of 85% or higher of all of those measures. So once you receive your award, it's important, to be able to share that information. These are things that you've been working on, you've been working hard on, you're watching, you're doing process improvements. So you want to share those results with your community and make sure, and your colleagues, and make sure that they know the work that you're doing for AFib and for those patients. So success is worth sharing. So just to give you a few ideas of promoting your Get With the Guidelines or Mission Lifeline award-winning hospitals and EMS agencies. So one of the things you can do is through internal communications. You can place table tents with the icon, tent ads on surfaces in patient waiting areas, in the cafeteria, patient rooms, at the desk, anywhere where you want to show that you are participating and that you are at award level for the best practices in caring for your AFib patients. You can mount signage in the restroom walls that are framed, posted ads, hang banners at your main entrance. I've seen hospitals that have banners hanging from, they're huge, from the top of their hospital all the way to almost to the ground with their awards that they have earned through the years. That is on there, that's posted right on their main entrance. You can put small ads or stickers on your patient menus just to show them again that you are participating. You can use the slide to announce your award at international or in your internal closed circuit. You can place an ad or an article in a hospital newsletter that maybe goes out to board members or to your patients or to whoever, or whatever newsletter that you may have. You can send a memo to the hospital board of directors, the CEO, and to the other hospital stakeholders so that they know where you are, what you're doing, and the work that you're providing to care for your AFib patients. And you can award, or you can add that award, like it's done over here. You can add that to your signature. So I'm not really a CV coordinator, but that's just how it would look if you chose to add that to your signature line. And so every time you send an email, that will be on your signature line. And again, it's just telling people that you're doing best practices. Some other ideas, you can do some virtual recognition celebrations, such as schedule a ceremony at your hospital or agency and invite some key team members, maybe doing at this point, most likely virtual, over closed circuit, over Zoom, over Teams, whatever. You can invite local dignitaries, board members, and also invite the media because they can help to provide some stories to the public that would give them some more information. For your hospitals, invite your EMS to your celebration. The EMS agencies can invite the hospitals to their celebration, and those are usually Mission Lifeline, more related to stroke and heart and CAD, but you also can do that with your celebrations. You can add them to scheduled staff gatherings, such as department meetings. Plan a dedicated service that recognizes the care team that has provided all of this care for the last however long. But sharing your great results that you're having from the information you can glean from Get With The Guidelines. And there is so many different reports. You have those 8 reports, but you can also run all kinds of reports like, what is it male, female population that's affected more? Is one race affected more than the other with the AFib? And, what about ablation procedures? How are you doing with the ablations? And then you can, again, benchmark those against all these other hospitals and then show it, at your hospital. If you can't publish online any of the all hospital stuff, you can do anything you want with your own data, but you can certainly present it during presentations for your board or whatever. You can have a photographer there to document the certification and award presentation if it's a small group within the hospital, and also others joining per virtually joining. Have them take some pictures and share those pictures. Just make it a celebratory atmosphere. You can give giveaways, disposable cameras, whatever, but prominently display your posters, banners, table tents, and you can present them at your community events you have. If you have the gala, the survivor event, anything like that. And then promoting within your community. So if there's a hospital and EMS agency are both recognized, then come together and promote your awards. Or maybe you have not only awards in AFib, but you also have an award with stroke, and you also have an award with CAD. If you are getting all those awards, then, publish them, share it with your community, come together and promote the awards. Again, placing the ad or banner, you can put that on your homepage of your website. Billboards, if you have billboards that you'd like to put up, running ads in local newspapers, or I've even seen people put things like their logo or the icon and a little bit of information on coffee cups. And partnered with Starbucks or with a local coffee company that was able to use that logo on their cups, so that they, again, are spreading the word to your community of the great work and the impact that you're having. Announcing the award on your on-hold message, put them on an external newsletter, and then your hospital pharmacy can also put it on their pharmacy bags, or even I've seen them in grocery stores before, where they put some ads on a grocery bag. That's back in the days when they used a lot of paper bags, but I've seen things happen like that. So be creative, but get the word out there. You can use social media. So your social media, your Twitter accounts, your Facebook, put that information on there that it's the latest and greatest research. You can copy this information, put it right on your Twitter account, and enter your award that you received and post it. So social media is a really good way to get that information out. So any questions about that? I'm happy, *6 to unmute or type something in the chat box. We're happy to answer any questions. Okay. So next thing, recent publications, educational opportunities, and resources. And this is just some information to share with you, some things that may be available for you. So the first one is a lifestyle and risk factor modification for reduction of atrial fib, a scientific statement from AHA. So there's a link to this article. It was recently published in March of 2020. And there again, this is some information that you can add to your information, share with the staff, share with your physicians, and make sure that you're incorporating any of the scientific statement information into your AFib patient programs. There was another article recently published in Medscape, which is the nursing, or it's a nursing Medscape, free of charge. I get a lot of information off of Medscape, but this one was published June 24th, and it talks about ablation lessens burden of atrial fib along with reoccurrence risk of AFib and the Cabana study. So it's looking at the Cabana study, but it's looking further at it. So it was published a while ago, the Cabana, about maybe a year and possibly 2 years ago. But now it's looking at using anticoagulation or medication versus ablation, not necessarily anticoagulation, but ablation versus treating your patients with medication and the effects on that. And it's a pretty interesting article. So there again, I downloaded it from Medscape. There's an article there. You may have to make an account, but Medscape is free and you can glean a lot of information. You can switch it up to say, you know, exactly what do you want to see? Do you want to see all kinds of heart, different issues with heart disease? Do you want to see just AFib? Do you want to see ablation? You know, whatever you want to see, you kind of pick and choose. Stroke, there's a lot of different topics. And then that will kind of customize it to your needs. And then we have a virtual AFib conference in Enduring, they call it, and that is on our learn.heart.org site. If you go in there, you launch it for free. There's credits available. You can see here 3.75 credits. It's a virtual thing. Look at it at your own pace. Look at it when you want to. This information is all free, and it has some very valuable information in these. They're like WebEx kind of a thing. Then we have the Afib series that was, this was presented probably, I suppose 6 months or so ago. It still is available on demand. The cost is $20 per person, but you get two credits. You can look at all of them, or you can look at, you know, whichever ones actually are interesting to you. So there's the stroke prevention and AFib, heart failure, AFib and kidney failure, treatment of AFib by ablation in heart patients, subclinical AFib incidence and management. So those are some other options if you're looking for CE credits for a low cost or free with the last one. Feel free to go in there when you have time and just take a look at those and you will receive your credit. Another place you can go look for atrial fib information. I went to the Professional at Heart Disease. So when you go into, you know, just your atrial fib, American Heart Association Professional Heart Disease, and then in the guidelines and statements, you would choose the guidelines and statements. Then this box opens up and you type in whatever you're looking for, atrial fib, whatever kind of information. And when I did this real quick the other day, 17 titles came up right away. So a lot of information that you could take a look at. Well, actually 18, there they are. So here's the 18 different titles that specifically are related to AFib. So, you know, they're available. Again, if you look those up, take a look at them. You can click on them. You can read the articles. You can save them. You can share them with your colleagues, whatever, but they're available for you to use. And again, in the Professional Heart, another place, I just went to search results at the very top of the page up here. So I went to Professional Heart where it has signs, volunteers, warning signs, and below all of these, I just typed AFib. And 1,162 files came up in 0.29 seconds. So there again, there's a lot of information there for you. You can scroll through, see what you're interested in. You know, AFib awareness you have. It can happen to anyone. So there's infographics that you can print and use. At your discretion, you can put your hospital logo on there if you would like while you're posting them in your hospital. And you know, there's just a lot of there's several infographics that you can look at that will, you know, just kind of depict what AFib is all about. So I'm not sure if you're aware of all of these resources, but there's quite a few out there. Okay, and then the science news is another place you can go. So I went to, let's see, I clicked on science news. Well, here is the link to that. And the first one that comes up talks about lifestyle and risk factor modification. So the full article's there, but there's some just summary points there that you can use in your advertisements or whatever you want to do with that. There's some support materials. Again, there's recommended readings that you can look at. So there's a lot of different resources there to get with the guidelines AFib and then the guidelines resources. So all of these are links. If you go to this link, you can go to all of those other links in red and use that information however you want, whatever might be interesting to you. And then there's also lots of information out there in the Afib resources for your patients and as well as for yourself. But you can print these really, really nice sheets here that they're visual, there's pictures, there's words explaining the different things, you know, how can Afib happen to anyone? There's more infographics, there's some checklists. Are you at risk? You could use those if you're at a community fair, blood pressure clinic, whatever. At cardiology office, maybe there's webinars you can look at there, partnering in your treatment, and then there's the guidelines and research. But I'm not sure if you're aware, but if you go into your Get With the Guidelines and at the very bottom where it says patient education, if you click a patient education after you've already filled in your medical history and those kind of things, then these sheets that are most appropriate for your patient will automatically come up within your Get With the Guidelines program, and then you can print those and distribute those to your patients. Most of them are 1 or 2 pagers, front and back, but really, really nice information with some graphics. There's also, if you go to the site for patients, there's things like some virtual, you know, showing what does Afib look like and what is it doing in your heart and all of those kind of things. So again, a lot of things. You know, I know a lot of people now have closed circuit TV, or they maybe use iPads with their patients for education, things that you could download and share with patients while they're in the hospital. There's also a page with arrhythmia resources. So there again, there is the link to that, but it's all kinds of information. And again, there's the educational sheets like this one that you can print for your patients. There's one about defibrillator, there's one about pacemakers, Holter monitors, just what is an arrhythmia, what is atrial fib. There's some Spanish printable forms as well for your patients. So pacemaker ID card, you know, all of those things, and then just some answers about heart fact sheets. So again, a lot of information for both professional and for your patients. Oops. Cryptogenic Stroke Initiative. This was an initiative that was started quite a while ago, and actually we have quite a few resources on cryptogenic stroke. As you know, probably about a third of those, a third of the strokes are cryptogenic, and many of those are related to atrial fib or undiagnosed atrial fib. Not necessarily all of them, but it could be a combination of that. The PFOs, it could be from, but there again, there's an initiative out there. It's got a stroke resource library. There's steps to avoid another stroke. Just because of the relationship between stroke and AFib. Healthcare resources, partner activation toolkits. So all of those things are available for you. This was in partnership with Medtronic. So the materials are pretty high quality because we received a big grant and worked with them to get this information out to the communities and to the professional systems. And that's really all I have. Is there anything, any questions, anything, information that you'd like to discuss, anything that, questions you have? Just *6 to unmute, and we're happy to answer those.
Hey, Deb. We do have a question in the chat box.
Okay.
She joined the meeting a little late and is asking what the metrics are to get the awards for Afib.
Okay, let me go back there and I will show you. And you also will receive a copy of this. So these are the metrics here. It's the ACE, Arbor, ARNI prescribed prior to discharge with LV ejection fraction below 40. And then there's the beta blocker prior to discharge with the ejection fraction less than 40. The CHADS2 VASC risk score documented prior to discharge. The FDA approved anticoagulation prescribed prior to discharge. There's the PT-INR planned follow-up documented prior to discharge. And there's the StatNet discharge in AFib for CAD, CVA, TIA, peripheral vascular disease, or diabetes. So those are the actual awards for achievement. Now, does everybody know how to actually look and run those reports? Because I can certainly get in and just do a quick demonstration if that's something anybody would be interested in seeing. Or maybe you already know. If you already know, that's fine. If you don't, I'm happy to share that. Put in the chat box yes, or *6 and say yes, or we won't do it. No? Okay. Well, if there's any questions that come up at all for you with the AFib module, feel free to reach out to me, reach out to your director in your area, and they're happy to run demonstrations with you, to help you run reports, to help you put together something if you need to show that to your management team, maybe, or your board, medical board of directors. You know, things that you would like to share with them about your program, just to make sure that they understand the work that you're putting into that. Any other questions, comments, review anything? Okay, if not, thank you so much for joining. I hope that you found this information informative. Again, you will receive a copy of these slides in the next couple of weeks, and the links on there, and reach out to whoever you may need from the American Heart Association. We are here to help you. Thank you, and have a great rest of your day.